Hello, um, my name is Lexicon Espinosa. I am majoring in psychological science and minoring in creative writing and American Sign Language. I am a junior and I am uh, doing the undergraduate certificate. As I was working on the basics of my certificate requirements, I realized more and more that there's a significant lack of research and services available for adults with disabilities, especially intellectual and or developmental disabilities. And I wanted to focus on that for my research. I was very lucky to find Dr. Armin and Dr. Sarai, Aid to Health of Picori project. Just before I joined on, they had finished a survey of local people with intellectual and developmental disabilities and their caretakers. They learned more about health priorities of the community and their caretakers. And now they are working on a guidebook. This guidebook aims to do two things. One, connect researchers with the health priorities that they uncovered, as well as the resources and tools to create more diverse research. And then two, to connect people with intellectual and or developmental disabilities to the research that is related to their health. And that is where I come in. I am working on a literature review, essentially, to create a summary in the guidebook of all of its contents, using clear communication and plain language. But what is clear communication? Clear communication is a method of communicating that aims to present information clearly so that it is easy to act upon and understand when it is first heard. There are five goals, five best five best practices. The first one is using a qualified medical translator when the patient doesn't speak in your native language. The second one is using plain language. Plain language is writing that is clear, concise, and well organized, and presented appropriately for both the subject and the intended audience. The third method is avoiding information overload, organizing, breaking down large paragraphs, and omitting non-essential information. The fourth one is encouraging questions. This is seen by by asking open-ended questions, such as, do you, what is confusing to you, or what questions do you have? These open up a space for more discussion rather than ending the discussion with a simple yes or no answer. And the fifth method is using teach back. This is when you ask the patient or person to repeat instructions or information back to you. This tells you if there's confusion or any sort of misunderstanding. Now, how do we implement plain language? Some ways that we can do this include limiting sentence and paragraph length. This keeps from overwhelming readers. Using common words. Words we learn earlier in life are common words because they are more frequently used. Defining important and complex words. If we think that a reader is likely to see the word or term outside of our writing, then it's probably going to be important for them to know. Organize by chunking together information that is important for our different audiences. Use an outline to make the document easier to navigate. Use clear and straightforward language. Avoid figurative language unless it's in a quote or if it's really important. Then make sure to explain what it's supposed to mean. Figurative language can distract and confuse readers, and we don't want that. Avoid passive voice. Not focusing the subject can make a sentence more complicated than it needs to be. Use easy to read fonts, colors, and sizes. The less time spent trying to read a section, the easier it is for you to understand it. Show information in different formats. Use text, graph, images, etc. If someone struggles with understanding one format, having other formats for them to look at helps connect and bridge those information gaps. The burden of understanding, of interpreting academic language into an easier to understand format shouldn't lie on the people who aren't experts in these fields. Cognitive inaccessibility makes it harder for patients and participants to understand, follow, or get advice and instructions. Everyone benefits, especially the communities who need it most. Thank you.
Hello, everyone. My name is Ree, and I am a psychology major here at the U of A. I am in my junior year and in the undergraduate certificate from it's an Orange Center. Today, I am here to talk about an exciting project that explores the power of art in helping individuals with intellectual and developmental disabilities. So the main question we wanted to explore was, can art help a person with IDD communicate their emotions, needs, and interests? In collaboration with the artists at Artworks, Dr. Yumi Shirai has led a research project that utilizes scrapbooks to help individuals with IDD communicate. We started by conducting interviews to understand the participants' support systems, what makes them happy, and how they can be best supported. Then, with the help of workshop facilitators, teachers, and additional support personnel, the participants created scrapbooks that expanded on these interview questions and displayed. There is an example of just one of the many pages the artists have created. This process took place over an 8-module workshop, and following that workshop series, the artists were interviewed once more with the same questions but at this time, they had scrapbooks with them to use as a reference. And to analyze our findings, we evaluated and coded the responses from each interview as shown here. And we then put the two side by side to compare the content. My role in this project primarily focused on this content analysis, but in addition to the scrapbook project, I challenged a few of the participants to use music and movement as a form of communication as well. Over the course of the past 8 weeks, Artworks has collaborated with a music and wellness class taught by Professor Jenny Gubner to elaborate on the way each artist experiences music. From there, Dr. Shirai and Dr. Gubner gave me the opportunity to add a movement layer to one of the groups or studios as well. The goal of this edition was to give another space to potentially tap into and express different emotions that resonate with the modules of the scrapbook workshop and possibly elaborate further on their responses. The combination of music and dance had really given us the ability to see who each person is in their entirety and give context to the information we learned from their scrapbooks. Moving over to our results, we found that when having the visuals provided by the scrapbook, the participants were able to better recall information about themselves. And along with this, in spaces where the participant had difficulty verbally communicating, they were able to direct the interviewer or support person to their scrapbook for their question responses. The integration of music and movement also helps the artist deepen our understanding of their story and allowed us to uncover new insights and emotions together. This project utilizes person-centered planning to create an alternative approach for self-advocacy and understanding a, in a variety of settings. Individuals with IDD can often have their feelings or desires dismissed because of a difference in communication, and the scrapbooks aim to provide them with a voice and sense of agency over their own well-being. It can also assist these individuals in healthcare or care provider settings, especially because they will not have to rely on other people to communicate what they need. Lastly, the addition of their stories and emotions through the music and dance adds another layer to this sense of self, both for the individual and for those around them. In conclusion, our project highlighted the transformative potential of art and facilitating communication and self-discovery for individuals with IDD. Thank you for your attention, and yes.
Hi, everyone. My name is Melissa, and I'm a senior here at the University of Arizona studying public health with an emphasis in healthcare systems and theory. I had the amazing opportunity to intern for the Sonoran Center, and through this experience, I was able to work closely with an amazing team, which is called Artworks U of A. Artworks U of A focuses on the exploration of diverse communication methods amongst artists with disabilities. One of our main projects this year was collaborating with our artists and crafting a scrapbook. And through this scrapbook, we found a wide range of innovative ways our artists at the U of A, Artworks U of A, can communicate their daily activities, needs, personality, and emotions through their own personalized scrapbook. Our scrapbook project, along with the research, strive to understand and promote how our artists interact, converse, and express themselves. With that being said, we had our goals centered around integration and overcoming challenging stereotypes. I, along with Dr. Yumi and my fellow AmeriCorps partner, Koi, were able to help our artists achieve this by exploring different ways of expression through our daily scrapbooking. Our methods we used consisted of providing assistance with creative expression and worksheets that inquired simple questions surrounding the theme of the scrapbook. This looked like assisting with writing, drawing, and putting together pages in the scrapbook and helping them brainstorm crafty ideas. We also explained the chapters in the scrapbook and provided tools. Some of the chapters included communication and learning, strengths and challenges, good days and bad days, and a personal safety plan. Our team also provided supplies to bring their visions to life. And of course, as an AmeriCorps intern, our main purpose was to always provide support and encouragement for our artists along with our team. A few takeaways from this project has been being able to see our artists have an increased understanding of communication styles, being able to uncover innovative approaches such as visual aids, and lastly, being able to feel included, safe, and respected, and also being accepted. A few takeaways for me as an intern has been being able to partake in reducing stigmas and barriers, gaining more empathy and understanding, and being able to address the importance of advocacy and promoting understanding for the different communication styles people have in our society. I want to give a special thank you to Selena, my preceptor, and Dr. Yumi for giving me this amazing opportunity to be a part of this wonderful program.
Hi, my name is Yurisa. I am studying medicine. I'm an undergraduate and I'm minoring in Spanish.
Hi, my name is Paulette. I am a graduate student here in the College of Public Health with an emphasis in global health. This is my second year on the project.
Hello, my name is Abraham Venegas. This is also my second year part of Discapa's project. I'm a grad student at the Library Information Science program.
Hi, my name is Cassette. I'm a graduate student under the school psychology program in the College of Education.
I am Dana Garcia. This is my first year in this under Discapac research, and I am an undergrad student.
So this CAPA started in the summer of 2022 and created the VIP program in 2023. So our project or our poster will be emphasizing on our second year of our project, not our first. And the purpose of these CAPAs is to amplify the voices of people who are within the disabled community that also live along the US-Mexico border, such as Nogales, Sonora. And we created these videos and used the power of storytelling by creating things like scrapbooks with the people that we interviewed.
So something that was very important throughout our project was community engagement. It was very necessary for us to be out there in the community because that's who we're working with, no? So something that we did do is once the videos were completed, we went and hosted a screening at Orsobo, which is one of our community partners. During our screening, they brought their family members, we had snacks, and they were able to watch everyone's videos at the same time. We were able to get their real-time reactions. They were able to get feedback from their family members or just their opinions. And it was very touching and moving to see just everyone's emotions because they were very emotive. So another thing that we also did was a lot of recruitment because we do want to have a lot more people come and create their own stories, scrapbooks, and videos. So in collaboration with Maricopa Community Health Center in Nogales, Arizona, we were able to host a health fair where they were able to get vaccinations, but we also provided a lot of recruitment flyers. We were able to show them some of the videos that have already been created to motivate other people to join us and want to tell their stories. All of their stories are respected in the way that they want to be told. So they have a lot of options, whether they want them written through photography, pictures, anything that they would like to explain their story as well. And further on, we do have our information dissemination. So these CAPAs was actually presented in 2 conferences between last semester. So it was presented at the American Evaluation Association by JC Farkas and at the Association of University Centers on Disabilities, where it was myself and Abraham who had the opportunity to go and present on our work. We had some audience members that came up to us and told us how much this project was amazing and how they supported us and just keep on going. So it was very impactful to be there and just listen to everyone's work as well. And we also had our website launch last November, where you can find all of the information on our project and you can also find all of the videos as well. So we also have our QR code there, so feel free to come up and scan it if you're interested in learning a little bit more about our project.
So the purpose of the project and our work as fellows was to amplify the experience, issues, and voices of disabled communities living on the Arizona-Sonora borderlands. That's why our project focused on recruiting and hosting workshops on Nogales, Arizona side and the Nogales and Arizona side and also Nogales, Sonora. So we went there to host workshops. We went there for health fairs to recruit people and to host the workshops. Our research tried to address the gaps in the literature and the research that often dismiss or there's not enough research done on disabled communities living in the borderlands. So as you can see, the pictures are of the workshops we did as well as the conferences, because we wanted to be with the community and hear their experiences and from their gather research to be able to fill those existing gaps in the literature.
So I have reviewed 12 scrapbooks, 5 coming from Arizona and 7 from Mexico. I found different modes of expression having drawings and visuals. the most amount. I found some interesting themes such as their love for travel, family-oriented values, and engagement in physical activities.
Well, so next steps for the Discapause project is to code interview transcripts that we've taken from participants about their experiences through the digital stories, the scrapbooking. And then we want to create more digital stories and reach out, increase our outreach efforts for community partnerships and participants to share their experiences.
Hello, everyone. My name is Leslie Trolia. I am a senior at the University of Arizona, seeking a major in psychology and a minor in Spanish. As a part of obtaining my minor, I joined USED as a trainee to understand what role the Spanish language plays in the accessibility of disability resources. According to the Americans with Disability Act National Network, there are over 60 million Hispanos and Latinos living in the US, and the presence of this population is especially apparent in border communities such as here in Arizona. Accordingly, providing translations of disability resources and legislation is essential to reaching all members of the disability community. After all, everyone deserves to have access to the resources they need, regardless of the language they speak or where they are from. As a trainee, I have been able to help USIP through providing Spanish translations for their flyers, as well as program descriptions. For instance, I have a picture of one of the flyers that I've translated, which pertains to our sorbo. And I have also been able to look into what obstacles face the Spanish-speaking side of the disability community, what is preventing them from accessing the resources they need, and also what can be done to make those resources more accessible to the community. For instance, some of the issues faced by the community pertain to people being afraid that their migratory status will interfere with them obtaining the help that they need, which is something that I'm quite familiar with. I am the daughter of two immigrant parents, and my grandparents are also immigrants. So I have personally seen how difficult it is for them to access resources they need, just because they don't know that the resources are there. And if they are aware of them, they are still afraid to reach out for help, just because they don't know how that might affect their migratory status, if that may even, they might put them at risk of being deported, for instance. And that is a very deep issue in the community currently. But there is actually resources that they can still use regardless of their migratory status. For instance, the Americans with Disability Act protects all, not just Americans, but literally everyone living in the US, regardless of their migratory status. That is one of the resources that everybody can use, but people aren't aware of that. So one of the issues is simply a lack of information provided in Spanish specifically. We need to make these resources more accessible to the Spanish-speaking community, as they are just simply not aware that they exist, or they're not aware that they can still use them, even if they have, even if their migratory status isn't, like, they're undocumented here in the country. One of the other issues is a lack of education in the Hispanic and Latino communities. Disabilities are a topic that is rarely talked about. Usually people only focus on physical disabilities and they completely disregard mental disabilities. That is also part of why people often don't reach out for help, because they simply don't really consider whatever they are going through to be a disability. Even a disease, even a disease such as diabetes too, which is very common amongst the Hispanic community. People aren't aware that can be a disability, that is something they can get help for at their work, for instance. They just don't know. Another issue is that when there are translations provided, often these translations are not really cultural. They're not really done with the culture and geographical nuance that they require. For instance, if you just translate something to Google Translate, it will be very literal. And sometimes that creates conflict since people are just not, they're not capable of understanding that information if it's just translated literal. And it's not taken into consideration the cultural or geographical nuances in the language. In addition, there is a lack of bilingual personnel in many organizations, as well as legislation. A lot of legislation pertaining to disabilities is only offered in English, or it is very wordy. It is very difficult to understand already for people who only speak English. It might be a little bit complex for them. And so it is made even more apparent when it is trying to be translated into a different language, where it is, again, it is needed to be culturally nuanced in order for people to be able to fully comprehend what it is being said. Thus, in order to address these issues, there's a couple things that can be done. For instance, there can be workshops offered specifically towards the Spanish-speaking side of the community. If more workshops are offered and seminars are offered in Spanish, it is more likely for people to be well informed, not just about disability education, but also about what resources they can access. In addition, organizations should dedicate resources towards hiring personnel that is bilingual and that is able to translate documentation and flyers and all kinds of resources into Spanish so that people can access those resources. And also content does need to be simplified. If content is simplified, if it's easier to spread that content, as long as one person goes to a shop, right? Let's say, for instance, if I go to a workshop, I learn the information, I can then share it with my parents, for instance. My parents work in the food industry, they can share it with their customers and so on and so forth. So if that information is made as easy as to digest as possible, is more likely to be shared, and thus more people will be better informed as to what resources they can use. That would be all. Thank you.